All right, welcome everybody. Sorry for the delay for the PowerPoint. Welcome to Monarch Family Chiropractic's Tuesday night workshops today on healthy curves and why our spinal curves are so important to our overall health and longevity of our spine and our nervous system. And I'm Dr. Kristen, and we're going to jump right in. This one has been a couple times before over the last year and a half, 2 years, and we've added some slides, some new studies, and some things that we really haven't touched on in the past. So we're going to jump right in, and I want to make sure that there's clarity around a couple things as to why we have curves in our spine, where there should be, when we develop them, and then what our spinal joints look like. So before we get into the curves, there's a component of aging or degeneration that happens from a process of the bones and the spine and the structure and the curves not being in a great position. And so when we have the curves of our spine from the side view, which we'll get to in a second with some x-rays, they allow the spinal joint to move the way it's supposed to glide the way it's supposed to create space where it's supposed to for the nerves that have to exit there. So those yellow nerves are coming off the spinal cord in the middle, and your spine is housing that nervous system, that spinal cord. And as the cord comes off the middle to each side, each segment, so every vertebra in your spine from the skull down to your tailbone have those nerves that exit the left and the right. So those are those yellow cords that you see on the picture there. And when we have healthy movement of the spine and curves in the spine, you have a spinal bone that looks boxy and square like it does in that far left picture, the textbook normal. Even in that phase one, it's still boxy and square. You have a disc space, which is the cushion. It's that little, what looks almost like a little cylinder, or what I call the jelly of a donut, kind of that center. And so those places where maybe I can mouse and kind of show you, right? So the disc is that cushiony, gelatinous placeholder, if you will, between each bone right there in the picture. And so if this curves are intact, you have that cushiony disc, and it helps that hydration. It's the shock absorber or the shock system of our spine. So when we compress it, when we stand all day, when we sit a lot, when we do compressive things like run, jump, compressive landings, that's all compressing into our spine, and we need that cushion system, because when you have that cushion system, you have space for the nerve to exit, which is right where this little hole is on the left and right side of between each bone. And that opening has to be big enough for the nerve to get through, for your literal signal to that part of your body, the cell, the tissue, the organ, all of the components that nerve is sending a signal to control has to be clear and free of interference and free of movement, or free of compression, so it's allowed to move in that space. So the curves are very important so that you have that. As we lose the curves, it doesn't change the bone right away. We know that we don't see changes on x-rays in the bony shape or the pushing or squishing on the disc like we see in that phase 2 there, where the bones start to get jagged and that space between starts to get smaller. That happens 7 to 10 years after that motion or that curve is lost, and it stops moving properly. So when we have poor motion, we may not feel any pain from that. We may not even feel any movement or restriction issues from that so far yet, but the bone will start changing. It'll start aging. So I always just say age is a number, because it doesn't, we'll show you a picture of curves of a patient that's in their 70s that looks healthier than someone in their 30s or 40s. So it's really about how the longevity of taking care of our spines and taking care of these curves is done throughout our lifetime. And if we have traumas, what we do to support the recovery of them beyond aches and pains and just muscle sprain strains, because we only get one spine. We can't replace spinal bones and anything that replaces your original parts. So they can fuse and stop things from moving, which doesn't support a curve and movement. And that may stop a progression of aging, but then there is no return from that. So we've got to avoid getting to those kind of places where you're in that late phase 2 or phase 3, to where there isn't a way to support that curve or change that curve much anymore, and overall get more function back, which is the goal. So we're going to jump into talking about what creates that. Why do we get like this? And how many of us or do you see walking around day to day look like this? Whether it is we're looking down at our phones, which is probably a good chunk of us many times, but we can have these types of forward motions as a student studying. If we read books in our lap and not up in front of our eyeballs, being down on laptops, iPads, devices. The problem with this is we're losing the natural curve in the spine by tilting it in the opposite direction that it's designed to go. So this is now so common that they've termed it tech neck or text neck, because this is what they see people doing all the time. That's creating such a stress on the neck curve that it creates this forward head posture, which literally decreases our lifespan, literally takes years from us. And it can happen for all those reasons said on the slide. It can be poor posture and something slowly over time. It can be a trauma like an auto accident where you receive some whiplash or some a force into your system that way. Sports injuries and slips and falls, I feel like it happens more commonly with on a regular basis and ignored because it's not something that knocks you out or concusses you or maybe takes you out of the game. Even a slip and fall with being in a state where people do sports year round, right? So we might do summer activities, but in winter we're on the slopes or maybe doing things where we could easily slip on ice or fall in the snow, and hopefully wearing helmets if we're out on the ski slope, but something to protect our head. But even that motion of falling backwards, even if we catch ourselves and don't hit our head, can create that whiplash and that loss of or a change of the curve and a stress to that natural curve. So we're going to talk about how much your head weighs, and then we'll kind of talk about what those curves look like naturally and when you develop them. But this is a lot of times what you guys see us talking to you about in the office is we've taken those posture pictures and we've taken those x-rays and we're seeing where your curves are. So looking straight through someone, your curve should be straight, right? You shouldn't have a curve. Your spine should be straight. But from the side view, you should have a neck curve that, say in this picture, looks like a C shape. Let me see, make my hand look in the picture to you guys, like it should be, right? So it should curve like this. And then in that mid back, it should go, well, let's get my hand like this, right? Through your rib cage and through that sternum and through all the shoulder blade area and down until that ribs end. And then it meets your low back and it should come back into a curve like this, right? A C shape in that low back. So the neck and the low back look the same. And then as you you almost have a fourth curve. It's not a curve really, but the bone of the sacrum, the tailbone there, then goes the other way, right? And kind of tucks back underneath you. Those curves from the side view are vital that you have. And when we're born and we start doing tummy time as a baby, that's when you develop that neck curve, is really in that first year of life. So a very important thing, and I say this because this starts at birth. This starts at 1 year, 6 months to 1 year old, when babies start doing tummy time and they're practicing holding their head up and holding themselves up on their little forearms or on their hands and doing things right in front of their eyes. That's very important for them, holding their head up and developing that the muscle and ligament structure to hold their head up and create that curve. And then when they get into that stage of, somewhere between probably 8-9 months in the year, they're crawling or they're scooting. That is the next stage to develop that low back curve. When they get those nice big Buddha bellies and they drop their bellies towards the floor and they're doing that scooting and crawling, that's helping develop their low back curve that goes in that same direction. So if you think about you're on your hands and knees and that curve goes down towards the floor, right? That's that C shape we're talking about. The neck and the low back do the same direction, and they have to do that and develop, or we start putting compression on our spines at an early age that should just never be there. Because then as we stand upright, and we start creating the forces down upon ourselves, then that middle curve starts to go the other way, right? And forms outward, if you will, versus inward. So that's how we get those three curves. And if we start doing technology early, we skip, maybe not doing as much tummy time, or if we're an overzealous, sometimes is what I would say, parent, at thinking that the faster they do it, the better, is wrong. And I'm just going to tell you, slow down and let your kid develop. Or if they're having an issue in a development stage, get them checked, because there's sometimes a component where they don't like tummy time. If they're having indigestion, if they get colicky, if they have issues with parts of their head and it doesn't glide and move right, they will not do tummy time for you. They don't want to be there. They'll flip right back over on their back. So if you see signs that they're not hitting those mile markers or they're not wanting to be in certain positions comfortably, there's a reason. Their structure doesn't want them there, and we need to support and correct that. Then when they can do that movement with ease, they need to go through that development process, and we need to not try to make them walk faster than their body's ready to. They have to go through those stages of tummy time, crawling, and then onto their feet. Otherwise, it's just too much stress into the structure before the structures even had time to develop. So that's how those curves become. And now let's look at an adult and some pictures of what we see when you guys come in, right? After years of something being different, normal is straight through you. Like we said, that green plumb line is straight through a body. When their line isn't matched that green line, right? So when we draw points at the ears and the nose and the center of the sternum and out at the shoulders and there at the chest and at the hips and at the ankles, that should line up to that green line. When we see that that doesn't match, we know there's possibly some curve happening side to side where that spine should be straight. And so you can see that gentleman's x-ray is off to the left where you see that little curve happening right here, right? Where his head clearly doesn't sit on top of his shoulders in an even place or in the center. And so from about his, mid sternum up, he just starts trailing off to his right and are looking left. So that is, again, something structurally that's happened, creating it to tilt this way or create almost a curve left to right, which is not natural, which is not normal, and is not a curve, not a healthy curve that we want to see, is like a scoliosis type curve. That puts a whole different level of stress on the spine, but in that same way we discussed, puts stress on the joints, it decreases the space, and it decreases the ability for that nerve to exit and flow through the rest of the body from the brain down to those body parts and back up. So here's that side view picture, right? So here's a natural, a curve we want to see. Now this is the body, the person standing the opposite direction is that picture I just showed you before. So it's still that curve this way. It's just now looking like a backward C, right? Reversed. It's just because the person's facing this way to our looking right versus turned face to the left. So has a low back curve, has that mid back curve. I get my hand to do, but doesn't have that neck curve. And that's where we see how far his ears at that red dot is sitting in front of his shoulders, right? And how far his hips are also leaning forward from that green line. And so that's creating stress upon it in that starting of that forward head posture. So again, here's just different pictures when the images get pushed with the head facing the left versus the right, same curve. So there's that C-shaped curve. The left side is normal, natural curve. And something that also happens when a curve straightens is the angle changes at the top bone here. Over time, when you see a straightened spine, and if I've got one that's worse than this one, you'll be able to look at that difference. But it's really important that when the brain stem has to send that signal down to all the rest of the parts and pieces below it, all the way down to your toes, if this first bone doesn't have this nice big angle to it, which that angle comes from this nice C-shaped curve being there, right? We have big boxy square bones. We have nice dark shape, disc space in between, creating that cushion, allowing for that. You don't see the opening here on an x-ray nearly as well, but allowing that opening to be there so that the nerve can exit. The very biggest part of the spinal cord is right here where it leaves the brainstem and comes out the hole of the skull and comes down into that first vertebra and starts at the top of the neck there. It has got the most mechanoreceptors and is the thickest right here when it leaves the neck and comes, or head, and comes into the neck. If this bone, this first bone, our atlas, if it flattens or gets more horizontal because that curve straightens, so as the curve straightens, that angle just starts getting more level, if you will, with the ground, more horizontal versus tilted like this, like we see it in the picture. What that does is as this bone gets more horizontal, the back of this bone gets up here and closer to the back of the skull where my little pointer is. So then that's compressing on that nerve flow right when it leaves the brain and goes down to the rest of the body. So if we have compression up there from a loss of a neck curve, then we're already getting less signal to all the parts and pieces of our body right from the get-go, right from where it starts. So it's like you kink the garden hose. It doesn't matter where the kink is along the way. We don't go turn the water up more at the house. We remove the kink, right? We remove the pressure or the interference that's not allowing that signal to get through, that water to get through. So it's just like that with the nervous system. That brain's got to send that signal out. And if it's already getting in a pressured state right where it starts, then it certainly doesn't have a good clear signal on it all the way down to everything in your low back, your digestion, all your organs, down to your legs and feet and toes. Then not only that, but back up the system, right? It has to come back up that nerve system and spinal cord, back up to the brain to tell it what the body just did. And so that brain gets a more disconnected, jumbled signal if that signal can't also get back up clearly or properly. So that picture on the right is what decay and degeneration looks like, what arthritis looks like. If you hear words like that coming from doctors or, x-ray reports, even from us, that degeneration and decay happens again over time. So this image of this structure being out of alignment, where this bone is way behind those top few and these ones below it, you can see that they don't line up and even just make a nice smooth line like this one does right here, where all the backs of the bones match up to each other evenly. That's again leaving that signal nice and clear. Oops. And so the bones are changing shape. They're forming these little points. So when you start to hear arthritis, or it's when these bones are changing shape and they're not so boxy, they're getting the points on them. That's the body trying to lay down more calcium and create more bone to join them to the one above or below it, because it knows that that's not a natural movement or glide. So in that state, it's creating a lot of dis-ease in the system, but it's also changing the bone on the inside. You would probably not even, many people would not even feel that. So again, normal posture, poor posture. There's a normal curve. Here's one, and that curve on the left is somebody that's 75. The curve on the right in the compression there, where they're showing there's those bone spurs, right? This extra bone in the very front of the vertebra where they're trying to connect each other right here. That's that forward posture and lean. The body's laying down that bone over decades in order to try to stop it from falling forward. And that's somebody that's a 55-year-old. So I've seen it this bad, if not worse, in some of my 40 to 45, 50-year-olds. It's just depending on when the trauma or the damage started, and the deterioration then just goes much faster. Our spines are designed to last us 100, 125 years if we take care of them by research and just showing that movement. So here's that mid back spine, right? And that's a natural curve on the left. There's a flattened curve on the right that starts to happen over time. Here's a study with using some of the newer ways to support and regain a curve if you've lost it. So I'll give you the kind of the brief overview as we started late, so I'm running behind. But this is a 30-year-old. You can see the forward head posture, so you can see how his ears are clearly way in front of the top of his shoulder over here. He does have a little bit of a lean and a tilt in his spine with his head and neck and his shoulders from that front view, but looking more at the side view, when people start to talk about that hump that they feel at the top of their back or shoulder, right at the base of their neck, right through here and the top of their shoulder. If it gets big enough, they'll call that a Dowinger's hump. And that just basically is a hump that's developing because, again, the head is pulling it forward with gravity, and you're not having your upper back is doing more work, and it starts to round it and overly round it. So there's ways in which we can bring that back and create a curve into the neck and take that pressure off the upper back. This gentleman came in with neck and shoulder pain at a pretty high level, a 7 out of 10, low back pain. Paresthesis is where both hands were on and off going numb. So if you have numbness and tingling, that is worse than pain. And that tends to get overlooked because it doesn't feel as bad. We're like, sometimes my hands go numb or I get tingly and then I shake them out, or I move in bed and it changes, or I stop doing that thing I was doing and it gets better or whatever. But if that happens often, that's not normal. And that's worse. That's more compression than if there's just pain and it's putting slight pressure on the nerve, creating an irritation. So numb tingly is a sign that there's most likely a lot of compression happening somewhere, and we need to get to the root of that and help correct that before that becomes permanent problem or disuse of hands or fingers or grip or things like that. So we're going to fast forward and look at what it's like to be in a particular device that helps bring in some of that translation and correction of a curve. Let me move my picture over so you can see some of this. But the left is his side view picture, right? Like we were looking at those posture pictures. The right picture is him in a device that helps translate and bring the ears back over the shoulder, works to work the muscles of the front and back side of the neck and the ligaments to hold the body in this different position, and then to help regain that curve that's lost when the head translates or rocks forward. So this usually happens after we've done several adjustments, usually a few dozen, that we start getting the right mobility of the spine, and then we can start introducing, there's different methods to get curves back. This is just one of them. And working with an exercise that you're going to do, that patients do actively, for 15, 20 minutes, 5-6 times a week. And that's going to start helping remold and change the curve. So this is this gentleman's curve, where the left was where he was very straight. You can see where that curve line is drawn in, or excuse me, where is, has that loss of translation. And then in the right, this is where he's wearing the collar, and you can see how much that head kind of starts to come back over the shoulders, and they're seeing what amount of degrees or is changed by while he's wearing it. So they see a 45 millimeter improvement. So now that we see that curve, that lordosis starting to become present, we now know, okay, this is the position we need them in, and they have to do a lot of this repetitive repair motion exercise for several weeks to months to help regain the curve. But doing that, 4 to 6 times a week gets results and changes curves. So I threw this picture in because a lot of times when we're all adjusting and we're talking about the muscles of the spine and the muscles of the neck that bother you so much and that irritate you, I think it's good for you to see with the image or the spine kind of faded in the background, a lot of those muscles that you guys feel or people come to us complaining about is the stuff on the back side of the neck, right? So right here, the muscle that attaches behind the ear, and then down here at the top of your shoulder. That gets so much, look how much stress and pull that's getting trying to hold your head up when your head's forward in that right picture versus when your ears are over your shoulders in the left picture. So the goal is that we just have less taut tension on this one up here, and you're using more of the front neck muscles that hold your head up and backwards or back over your shoulders, versus when we let our head fall forward, we stress that backside. It's trying to hold our head up from falling over, and we really compress or tighten these ones on the front, which could be so tender right into that collarbone, which then makes it feel hard to kind of bring your head and shoulders back, right? So there's muscles that's the way they sit and lay, and those are the ones that are playing tug of war when the curves are stressed. Here's again, just a good low back curve on the left, one that is not curving anymore on the right and flattening out. And again, the back of the bones there don't line up with each other. That puts a lot of stress. I think the low back X-ray is an easier one to see the hole, right? Easier to see the opening on the side or on the back there, and how those nerves have to exit this big opening. And when there's a curve and when there's space between them, there's a nice big opening for them to go. When our bones do not curve in that proper direction, you see how much smaller those openings are back here along the back of the spine, those dark spaces. That's a lot less room for the nerves to send its signal down to your intestines, to your bowel, to your bladder, to your reproductive organs, to a lot of the motility, right? For our digestive system, as well as all the feeling and sensation down to your legs and feet. So I leave this one in here, but there's other pumps and methods of things you can do for the rehab of the curve that just has a lot of research behind it that we utilize in the office, depending on the person's age, mobility, injury level, all the stages they are in that degeneration level. And sometimes this is an easier method to work on getting the curves back, the disc space plump again, and pressure off of the nervous system and the spinal cord. Those are MRIs that they use to test this particular device. So, and those are just some of the research that we went over last time in the Healthy Curves workshop of just the percentage of improved. So, during the activity and during the motion of curve change, 72% increased. And then people that maintained that increase over time, 16%. I think we see much higher percentages with different ways of changing curves, different methods. And so we want to see those numbers be higher, but there's different options out there based on where you're at. So I end with, hopefully you learned when curves develop, why we should have them, where they are, what direction they should be, and when viewing someone from the straight view, there should be no curve in the spine for a healthy curve. And that really our curves are designed to last us well into our centenarian years if we take care of them. So we always ask, who do you know? Who do you know that isn't getting checked or may have that posture of a really rounded upper back or a head really far in front of their shoulders? That is putting stress on their nervous system, which is literally decreasing their years in life, the longevity of the years they live. Because the more that ages, the less mobile they'll be and the less functioning their organ systems and nervous system and body will be, because it will not be able to support itself in those later years nearly as well. It does start to create some very obvious wear and tear. So if there's anybody you know that we can check, our simple exams with those posture pictures and x-rays show if that's there or not. So we can determine within an hour visit, how can we support you? Is that there? And is there something you should know that you didn't already know was there, or that it can change? Some people are just told that looks normal and there is nothing to do about that. And that is just incorrect, old 20, 30-year-old data that isn't true anymore. So there's ways we can support you and can support the longevity of your spine. If injuries happened and maybe something you didn't even know was there, something that occurred when you were younger in life and just didn't know that was developing as you were older. So if we can support you or anybody you know, let us know. And we're happy to check people and go through that exam to determine if there's something they can do to be supporting their healthy curves and maintaining them or getting them back if they've lost them. So thank you for joining us. I hope all of you can bring in some takeaways and let us know what you learned about curves that you didn't know. Most of you that are on the call, you probably know what your curve is and what we're working towards. But I appreciate you sharing and letting us know in the office, because other patients hear that and patients come in and hear something somebody else is saying. And I think it also helps them realize that it's not just them, or it's not just their spine, or this just didn't happen to them. That's unfortunately super common to see in this day and age. And we're only going to see it more with the devices and the way in which we kind of live our Western lifestyle. So limit your screen time if it's in your lap, and get things, and if nothing else, a really healthy change to support a curve that you can do outside of the office is just put things at eye level and get things out of our laps and in that forward direction, and just get things more up in front of us to where we're not creating a bad habit that can be avoided. So we look forward to seeing you in the office and getting your takeaway. And thank you for joining us tonight, all of you on Zoom and in the office here. And we will wrap up for tonight and see you next Tuesday. Thanks so much.
Thank you.